pleasure to share with you the results of our work on the profile and the dynamics of neurofilament light chain protein in the course of multiple system atrophy. MSA is an alpha-synucleinopathy, a rapidly progressive neurodegenerative disorder which manifests with a combination of cerebellar ataxia and Parkinsonism in addition to autonomic failure. Disease-modifying treatments are being currently trialed in MSA, but approaches that are based on clinical measures alone are challenged by the heterogeneity of phenotype and the pathogenic complexity of this condition. NFL has been explored as a reliable biomarker in several neurodegenerative disorders. The data in MSA have been limited, and therefore NFL is not yet routinely used as an outcome measure in MSA. We wanted to explore what is the role of NFL in the disease process, in the progression, subject selection, and treatment effect monitoring in MSA clinical trials. For this, we conducted a cohort study and recruited cross-sectional and longitudinal cases in multi-center European setup. Plasma and CSF concentrations were measured at baseline in 212 patients, and in a subgroup of 47 MSA cases, we measured it annually for a mean period of 2 years, in addition to clinical, neuropsychological, and MRI brain assessment. As expected, the median concentration of NFL was significantly higher in MSA patients compared to healthy controls for both the CSF and for plasma. What was somehow unexpected was that when we analyzed 105 plasma and CSF matched samples, we found that NFL CSF increased faster than the plasma in the early stages of the disease. But the plasma and CSF correlation became stronger as the disease progressed. Our next question was how NFL reflected the disease severity in MSA. For this, we used the validated MSA clinical scale, UMSARS. We found a statistically significant correlation between plasma NFL levels at baseline and disease severity represented by UMSARS. Additionally, NFL concentrations correlated with increasing disease stages as defined by clinical milestones. Next, we assessed the association of plasma NFL with imaging measures. In a subgroup of 50 cross-sectional cases, we found the strongest statistical correlation in the striatum, followed by the middle cerebellar peduncle. These results were further validated in a multiple regression analysis between NFL levels and regional brain volumes with adjustments for age, UMSARS, and disease duration. Furthermore, plasma NFL correlations with regional brain volumes were stronger when assessed by clinical subgroups. Longitudinally, higher level of baseline plasma NFL were significantly associated with greater subsequent decline in whole brain, pons, striatum, cerebellum volumes, and MCP width. Using the rate of change in NFL and the rate of change in brain region volumes in a longitudinal cohort of 14 patients, the analysis with adjustment for age and disease duration revealed a statistically significant relationship between the rate of plasma NFL concentration with MCP width. No previous studies have assessed the NFL profile and its prognostic value in a large MSA cohort. We found that higher plasma NFL values at baseline were associated with a more rapid progression and a shorter overall survival. This survival predictive effect was consistent for both MSA subtypes. Patients with blood NFL values above the median had an increased mortality rate. Given that plasma NFL showed a significant correlation with MSA severity, we established a disease trajectory for MSA using plasma NFL and UMSARS score to study the disease progression. Using a 2-degree polynomial regression analysis on UMSARS and disease duration to model MSA progression, we noted significantly raised NFL in early MSA, which was associated with further increase in UMSARS during disease progression. This is followed by stably elevated NFL levels during manifest disease, with subsequent reduction in advanced disease stages, though NFL remained significantly higher than in healthy control. Finally, we performed sample size estimate for MSA intervention trial. Using the reduction of NFL levels as an outcome measure, we showed that the required sample size for intervention trials with 1-year follow-up were estimated based on 12 months changes in plasma NFL, shows that a trial with 28 participants, 14 per group, would be able to detect a 30% reduction in annual NFL level at an 80% power. Compared to using clinical scores alone, where 129 per study arm would be needed for the same effect size, this is a significant reduction in number. In conclusion, in this large and well-characterized MSA cohort, we found that NFL correlates with disease severity, particularly in the early stages of the disease, has a curvilinear change as the disease progresses, and predicts survival. NFL concentration at a given time point correlated with regional brain volumes and were also indicative of the likely rate of brain atrophy. The association with brain volumes and brain atrophy rates was specifically noted in the striatum, pons, and MCP width, and a similar correlation was noted in the longitudinal cohort. These areas correlate well with MSA neuropathology, as evidenced by post-mortem neuroimaging studies. We show that NFL levels might provide means for significantly reducing trial sample size. Our longitudinal analysis of plasma NFL data, the correlation with validated clinical rating scales and the brain structures, together with disease modeling and assessment of sample size estimates for clinical trial, make the value of plasma NFL more comprehensive for patient stratification and treatment effect monitoring in MSA clinical trials. To date, there is no other validated biomarker for MSA that has demonstrated a similarly strong association across a range of clinical, functional, and neuroimaging outcomes. We recommend that quantification of NFL concentrations in plasma be included in further observational and therapeutic trials in MSA. I am grateful to all the patients and families who contributed with samples for this work as part of a large collaboration project across Europe. I would like to thank collaborators in the UK, France, Spain, and Germany, and Russia for sharing data, samples, and their expertise. Thank you for your attention.